Botox is sometimes called a woman or maybe man's new best friend. It promises to reduce the signs of aging without the surgery. And while the lunchtime treatment can be painless, there are scary numbers to consider. About 16 million cosmetic procedures were performed last year, but not all of them were done by medical practitioners, putting patients in serious danger. Now, a new Botox bill aims to prevent medical assistants and estheticians and dental hygienists from performing certain procedures. Here with more, board-certified cosmetic and plastic surgeon, Dr. Stephen Davis. Hello.
Hi, how you doing?
You are fresh off a trip from the West Coast.
I am.
Let's talk about this Botox bill. How will it affect, I guess, what you do and what patients might come in and see happening?
Right. I'm super passionate about this thing because, you know, as a board-certified plastic surgeon, the #1 thing we're trying to do is to make sure that patients are safe with all these cosmetic-type procedures.
Yes.
And the bill is actually supposed to be looking at who should be allowed to use these products. And you got to remember, you know, everybody that's out there listening right now knows that they have a superpower or a thing that they've studied and they've trained and they learned how to do better than anybody else that they know. And because of that, they're expert in it. So if I, you know, give you a guitar, because trust me, I've been trying to play the guitar for a long time. And then when I went to hear Clapton, I went, wait a minute, I'm playing a totally different instrument than he is, right? So Botox isn't just like a product that you can go buy in a store and figure you're going to get the same result that everybody else is going to get. So it has to be done. Behind that syringe is a trained professional that knows how to do this stuff. So I've been involved in a lot of different organizations that literally go across the country training doctors and nurses in how to use it safely and also how to expand their palette of use so that you can facially sculpt the whole face.
Is there people that we think just should not be doing this?
It all depends on their level of training and expertise, and you know, the companies like Allergan that make Botox want it to be this incredibly safe, you know, product. And also with all the facial fillers, every 4 to 6 months it seems like there's another facial filler that comes out that can do amazing things to make you look younger. And we as plastic surgeons even go and get training so that we can teach other people how to use it safely. So
is the concern coming from, Dr. Davis, botched jobs? I mean, I'm sure you see that. People come into your office like, this didn't go as expected.
It's exactly what it is, because over 20 years I've been in practice, and I can tell you hundreds of stories of patients that have come in, and maybe they went to a Botox party on the weekend. Or they did something, and they now have these results that really make them look odd and scary. And worse than that, there are really bad results that have like implications that are more medically serious, and I don't think people give the same level of care to something like that that they really should be thinking about. And I know that when I talk to patients about why they never did anything, let's say to inject filler in their lips, they always say the #1 reason, they don't want to look crazy. And they've seen so many of their friends and family members that do look a little nutty, they're staying away from it.
So are there questions that we should ask if we say, okay, you know what, I'm ready, I want these 11s gone? Just stick with the plastic surgeons for now? Is that kind of...
You should stick with... You've got to ask the questions like, what kind of training have you had to really learn how to use this thing? It's not that you could just have a license so that you could buy the product. Like, where have you trained? What have you done to make me understand that you know what you're doing with this stuff? Because everybody's a little different. You know, someone who comes in their 20s to get Botox and someone that comes in their 60s or 70s, you have to know how to inject it differently. Some patients that have had other kinds of procedures. One of the things that I see all the time is there's patients that have had surgical procedures like facelifts on their face over the years, and they want to also get into this Botox thing because they want to continue to look young. You have to learn how to inject those patients even more differently. And guys versus girls, I mean, there's a lot of different things to know.
So you can't let the price, when you see, oh, there's a big good deal on Groupon or whatever these sites are, or the ease and convenience of it lure you in.
Exactly, and that's what I'm trying to say. It's not like you're just buying the product, you're buying the guy behind the syringe that's also, you know, injecting it into you.
Thank you so much.
Nice to see you.
We'll keep an eye on this one.